B11.8 infertility treatments. This is for higher tier students only, but most of my group will be taking this paper anyway, so it would be good for you to know this information. So follow on from the previous topic where we're looking at the artificial control of fertility, we're looking at different treatments to help those that are infertile. So infertile means that they struggle to get pregnant or can't conceive. So in the UK, as many as 1 in 6 couples have problems having children. There may be many reasons for infertility. It may be linked to lack of female hormones, to damaged oviducts, or to a lack of sperm in the semen. There are many reasons for this. Common causes of infertility are obesity and other eating disorders such as anorexia nervosa, but also one of the most common is age. So women who sort of 35 plus, you become less fertile quite quickly the older you get. So I'm going to look at 2 different ways of helping with fertility. So we're looking at whether a woman's just lack of ovulation, so not releasing an egg, or whether there are other more complex problems that need IVF treatments. The first one we're going to look at is lack of ovulation. So some women want children but do not make enough FSH to stimulate the maturation of eggs in the ovary, so no eggs mature. Fortunately, artificial and man-made FSH can be used as a fertility drug. It stimulates eggs in the ovaries to mature and also triggers estrogen production. So that's quite sort of like a simple, quick problem that we can sort out, or that can be sorted out. Now, things that are a bit more complex is IVF. I'm going to show you a diagram of this in a minute. So I'm going to talk through it and then I'll show you a diagram which might be a little bit simpler for you to understand. So, in vitro fertilization, so IVF, is a form of fertility treatment used if the oviducts have been damaged, so the tubes between the ovaries and the uterus, blocked or damaged by infection. If an egg donor needs to be used, so for example if it's a female, so the mother's eggs can't be used, they may use a donor, they'd use IVF in this case. Or if there are no obvious causes for long-term infertility, so if a couple have been trying for a baby for a long time, there's no obvious reasons why, they'll then start a course of IVF if they still want kids then. In some cases, a man produces very few sperm, or the sperm do not mature properly. Individual sperm can then be injected into an egg during the IVF process if this is the case. So if the sperm in the man, there's not many of them, or they're not strong enough to swim and they haven't matured properly, so they can't do their job, then IVF will help with that process. So this is how doctors can help with IVF. So they can give the mother synthetic FSH to mature eggs, followed by LH to bring the eggs to the point of ovulation, so where they're going to be released. They could then collect the eggs from the ovaries of the mother and fertilise them with sperm from the father that's also been collected, and this can be done outside the body in a lab. The fertilised eggs that have been created are then kept in special solutions in a warm environment to develop them into tiny embryos, so these environments mimic what it would be like inside of the uterus. At the stage when the minute balls of cells, 1 or 2 embryos are inserted back into the uterus of the mother, therefore bypassing the faulty oviducts, so we can artificially make a embryo. And I'm just going to show you the diagram that shows this. So fertility drugs are used to make lots of eggs mature at the same time. We then take a few of those eggs out and they'll be stored in a petri dish with a special solution in it. A sample of the semen is collected and the sperm and the eggs are mixed in the petri dish. So remember, only 1 sperm can go into 1 egg. The eggs are checked to make sure they've been fertilised, so you use a lot of microscopic techniques in this to make sure you don't damage the embryos. And then once the fertilised eggs have formed tiny balls of cells, 1 or 2 embryos are put back into the uterus of the woman and hopefully the baby will develop. I'm just going to show you another table whilst we're here. The success rate of IVF is quite low. So this is going to be one of the disadvantages I'll talk through in a minute. Women that are under 35, their success rate from IVF is only 32.2%, and we can see as the woman gets older, the success rate drops dramatically as well. So IVF is sort of more often doesn't work than it does work. Finally, we're going to look through the advantages and disadvantages of fertility treatments. So advantages are it gives men and women who would otherwise be infertile the chance to have a baby, and mature eggs can actually be collected and stored for later on. So if a woman wants to use her eggs later on when she's a bit older, when they wouldn't be as good, so the older a woman gets, the less good her eggs are, the more likely So if an older woman has a baby, more likely the baby is going to be born with sort of disabilities. So a young woman could save her eggs and then use them later on if she wanted to, but there are some ethical issues around this. So for example, if the eggs are saved but then the partners break up, or if the woman dies, can we still use the eggs then? There's lots of ethical issues around that, but that could be an advantage to use younger eggs if you want to have a baby later on in life. Looking at the disadvantages, quite a long list. IVF is expensive. The NHS may provide IVF, but many people end up paying thousands of pounds for repeat cycles. The IVF will sort of only give the NHS, will only give you sort of one round, maybe two, of the cycles. It is not always successful, as I mentioned earlier. If the donors are used, then the baby is not biologically the parent. So if you use donor egg or sperm, then it's going to have different DNA to you. Health risks for the mother. IVF is very emotionally and physically stressful. Increased chance of multiple pregnancy. This increases the risk of both mother and babies, more likely to lead to stillbirths, so babies born dead, or premature births, so early births. It costs a lot of money to keep a premature baby alive, and if they survive, many will have permanent, often severe disabilities, so you can see there's quite a few disadvantages.